Good morning, everyone, and sorry about this difficulty this morning. It's always something, as I'm sure you're aware. Again, this is Dr. Safadi, Allergy Clinic, Ohio, for your weekly pollen and mold report for Saturday, June 9th, 2018. We are getting towards the end of the spring allergy season. It may not feel like that. Um, it was a fairly strong season over the last few weeks, and it's still there, and you're still feeling a lot of the symptoms associated with that, primarily due to what's called a priming effect. It's a phenomena in which the allergy cells are already active and agitated, and they only need a small amount of the allergen, whether it's pollen or mold, to be triggered and cause those symptoms that makes you uncomfortable. So for today, we're seeing that trees are fairly low. We're still seeing some pine, occasional hickory, occasional mulberry, but nothing much to talk about really as far as tree pollen. Of course, that flying cottonwood you see is not an allergen. It can be irritating. It can have a lot of other pollen trapped in it and mold, but it's not the cottonwood pollen. Cottonwood pollen, we've seen that weeks ago. It was back in April, May timeframe. So there's definitely no cottonwood pollen in the air. Mold continues to be an on and off phenomena. It's gonna be with us throughout the summer and fall, and there'll be days in which it's gonna be high and days that are gonna be very high. So it's something that is part of living in Northwest and Central Ohio area. Weeds, not yet. Maybe in the next month or so, as we get definitely towards the July, August time frame, we'll start seeing more wheat pollen. And of course, ragweed season starts anywhere between the beginning to the middle of August. So for those who are specifically allergic to ragweed, there's still a few months before we see that. So with that being said, I'm gonna try to move towards the questions and answer area, and see if any of you guys have any specific allergy questions that we can help tackle. Let's see. Okay, good morning, Jane. Good morning, Barbara. Hello, Mary. Please let me know if you're still having any difficulties as far as hearing or joining the broadcast. Just going through some of the comments here. Okay, see, so Barbara has one comment. Let's see if I can bring that up. Yep. All right. This question here from Barbara says, I really would like to hear you comment more about other options to surgery for nasal polyps, as they have me scheduled for surgery next month. Um, for those who are familiar with or not familiar with nasal polyps is not necessarily an allergic response. Um, there are some patients who have polyps in the nasal and sinus cavity area that can be large, a grape size in a sense, that can block the passages for the sinuses and result of a lot of discomfort as well as infections. Patients who have nasal polyps many times can have also increased incidence of asthma, as well as, of course, recurrent sinus problems. So, in the past, the treatment options that were available were primarily heavy doses of corticosteroids, either orally or in form of nose sprays, to help control those polyps and make them shrink in size. Surgery was also a valid alternative and still is, especially if the size of the polyps is fairly large. The problem with nasal polyps and surgery is they tend to reoccur. So you go through the surgery, things feel great, and then symptoms come back. So everybody's different, and frequency of return of those polyps can differ from time to time and from patient to patient. So it might work for you. More recently, though, there has been some advancements and options available for treating nasal polyps. We do know that nasal polyps are formed of certain types of cells called eosinophils. These eosinophils have been targeted for treatment, not necessarily for nasal polyps, but for primarily what is called eosinophilic asthma. And they can work great. These medications reduce the numbers of eosinophils and therefore makes the asthma much more controllable. So they are not indicated for treatment of nasal polyps at this time. However, there are studies being done, and in the patients that we see, if they have significant degree of asthma and nasal polyps, that makes a strong point that using such treatments can either avoid the need for surgery or definitely, hopefully, reduce the chances that you're going to have reoccurrence of the nasal polyps and reoccurrence of those symptoms. So it's not for everybody. It's used. This treatment is used for treatment for asthma, and if we see somebody with nasal polyps and asthma, then it at least makes us think that these could be of value as well. So hopefully that answered your question, Barbara. We have a lot of questions coming through. Excuse me if I missed any of them. I will make sure I will go back and answer those in the comments later on if need be. I see a response from Barbara. Say, I'm packed front and back, have asthma, 5th time around for surgery. As I mentioned, it's fairly common to have repeated surgeries. So yeah, give us a call. I think it might be something we can discuss further and might offer an option for that. So okay. There's another question from Trish. It says, my sinus is terrible and affecting my asthma. What could help over the counter? I'm on steroids and antibiotics. something natural I can do to help. Something natural, the use of sinus rinses, which are readily available over the counter, can help sometimes when you have an infection, to help you get rid of some of the mucus that has accumulated in the sinus. One thing about those, though, try to avoid overusing sinus rinses. The lining mucosa of the sinus and the nasal cavity has a lot of defensive properties, and it acts as a good barrier in the fight as a first line against infection. So when you do sinus rinses, it's like washing a plate that has, grease on it. It sloughs that mucus barrier and possibly expose the underlying mucosa, making it more vulnerable even. So I recommend only using them for a short period of time. When you have infection for a couple of weeks, once a day, not more than twice a day at any time. Other than that, I think you can certainly, for a short period of time, also use some decongestants, like nasal decongestants, for 3 to 5 days with an infection, to help open up the sinuses, allow that infection to drain out. So, hope those help. Lisa had questions about having had 2 surgeries for her sinuses over the last 10 years. Pressure on upper teeth more than before. That's a good point. Upper teeth pain is one of the most specific symptoms of underlying sinus infection. So, unfortunately, if you're having the infection again, make sure first that you're getting treated with an adequate amount of antibiotics. It's not uncommon that people get treated for so-called sinus infection for short periods of time, which is inadequate. So you finish a 7-10 day course of antibiotics, you feel better, and then it's back again. In general, if we are treating true sinus infection, which sounds like you might have, then the antibiotic treatment should be first with a fairly strong antibiotic that has good bacterial coverage. First line antibiotic therapies like just plain amoxicillin or azithromycin or Zithromax may not be enough. But more importantly, also, the course of treatment should, when it's become recurrent and a problem, it should at least be 3 to 4 weeks of antibiotics. Many times we go even much longer than that. We cannot assume, if you have a significant degree of infection, that an arbitrary number of days of treatment are going to make your sinuses cured. So, in that kind of situation, we will treat aggressively for a long period of time, and many times we revert to using imaging, like a limited sinus CT at the end of treatment, to make sure that those sinuses are cleared. And that's the only way to make sure that you've actually completely removed or treated that infection. Just feeling better alone is not enough to say that infection is completely gone. Just compare that to having certain weeds in your garden. If you've got rid of 90% of those weeds and left 10% behind, those weeds are going to grow back. And the same applies to a sinus infection. So we absolutely, in persistent, chronic, recurrent, problematic sinus infections, you have to have some kind of imaging studies to make sure that that infection is completely gone. You're welcome, Barbara. Let's see what we have other questions. Skipped this one earlier from Karen about the sinus problem related to allergies. Most definitely. Allergies are an important aggravating factor for sinus infection. People who have allergies are more likely to get sinus infections. It's a simple fact that when you have allergies, your nasal and sinus tissues are swollen, so the pathways for drainage from the sinuses gets blocked, and whenever you get blockage, you are more likely to get an infection. This applies whether it's your sinus, whether it's your ears, whether it's your urinary tract. Anywhere there is an obstruction in the body, you're more likely to get an infection. So treating the allergies, keeping those passages open, will definitely help reduce the occurrence of sinus infection. Now, if you're persistently stuffed up on one side only, in those situations, I strongly recommend that we get some imaging study, a limited sinus CT, determine if there is an anatomical problem, if there's significant nasal septal deviation, then we might want to correct that. It's not unusual that people will have one side of their nasal patches, whether it's right or left, be narrower than the other. It's actually, that's the standard. It's exceptional that people have exactly identical pathways on each side. So some degree of nasal septal deviation is the norm. It's only when things get extreme and that we need to pursue treatment to fix that. But if you can imagine one side being half the width of the other, if you have allergies, it's going to take much less on the narrower side to get blocked. So you're going to feel that. The other wider side might get some swelling, but it's going to still be open. So I think somebody has to look at that, possible imaging, and then go from there. Alright, I know there's definitely more questions. You're welcome, Lisa. You're welcome, Trish. Christy's asking about, she was outside. Let me see, make sure we got that in. She was outside. The next morning she woke up with a sty in the eye. Could it be caused by my allergies? Not directly. Allergies can cause itchy eyes, and you end up rubbing the eyes and potentially aggravate an area and cause the bacteria to get under the skin area and the eyelashes and induce an infection. So yeah, but you can definitely get styes without allergies as well. So on that topic, some of the simpler things to use, and some warm compressors. Some people use tea bags over that sty to help maybe make it resolve quickly than usual. In some cases, we end up using also some antibiotic eye ointment, which might speed up the process as well. In rare cases, people have those also poked under sterile conditions to drain a fairly large abscess, if that's the case. But that is not needed in the majority of the cases. So it's uncomfortable. But hopefully it will not last too long. Let's see what next. There's a question from Mara K. As what time of year do I expect pollen for English plantain and lamb's quarter? Generally in the fall time frame. Both of these are weeds, and their pollen also starts around the ragweed time frame. So we might see some in July, but generally it's August and beyond throughout the fall. So I think we got everybody, I hope. Fresh on those and see if we can pull some new. Again, thank you everybody for joining us. I hope you're getting some benefit from these live broadcasts. I certainly enjoy doing them, and learning to get through some of those technical issues that pop up every time. So hope to see you again next week. And again, apologies if I missed anybody, but I'll be looking through those comments and make sure that those get answered as well. Wish you a wonderful week ahead. Until next week, this is Dr. Safadi. Bye-bye.